what does this mean? This basically means that when we talk about music therapy and what we try to do with music therapy to benefit people with dementia, we are using the clinical evidence-based of use of music that has been developed through university research. I'm a trained music therapist, and I'm trying to use music as a stimulus, a way to gain an entry point into the brain to help to awaken the brain, and to use music as a means to actually create some kind of response which enables the person's behavior and hopefully his ability to engage with his surroundings to be stimulated. So you can see this is a very simple diagram. You can easily find it on the internet, but it shows you that the brain is hardwired to respond to music. And you can see where all these different regions of the brain are responding to musical stimulation in different ways, from the emotional reactions to behavior, expression, decision-making, movement. And we talk about how music actually, through research, has shown that music therapy is an effective and valid treatment support for people with dementia. And these are just some of the known benefits that are listed here on the right side of the slide. So we are interested really to understand not just how music can create an awakening effect in the brain, but you can see here from an MRI image that the brain at rest seems to have less activity. But where you see these orange and rich patches on the right side of the MRI, you can see actually where more regions of the brain, just like the slide I showed you before, have actually been activated by music. So one thing that is remarkable is the research shows that even for people with dementia who are quite severely demented, it is still possible for music to activate regions of the brain and to create a stimulant effect. So this is just a quip and a citation for a research study that was conducted by the Center for Alzheimer's Care in the University of Utah. That was in 2018. And newer research actually shows that there may be actual regions of the brain where music, memory, and emotions actually meet. And this means that even when someone who is in various stages of dementia and they may be quite advanced, they are still capable of responding and being activated by the music. So how does music therapy help dementia patients? The most important thing to acknowledge first and foremost is that music creates a safe space. And what do we mean by that? It means that when we are using music as a form of stimulus, as a therapeutic support to people with dementia, what we care about is to make sure that we don't further traumatize or create any harm to the person with dementia. And because music is usually something that people associate with entertainment, with relaxation, with recreation, they don't often think of therapy or treatment when they think about music. So as music therapists, we are trained to extend that kind of positive, safe environment using music to support the needs of the individual with dementia. Many of the things that we do with music activities, whether it's singing, whether it's moving to music, playing instruments, and so forth, they are also fun and enjoyable, and they are highly engaging. They are designed to be mentally stimulating, and most of all, they are non-stigmatizing. And what this means is preservation of personhood, which you may have seen earlier in my slide, is really, really important. We strive to preserve the dignity and to provide the dementia patient with a sense of support that allows them to be themselves, allows them to be activated and awakened through the musical interaction, but ultimately to feel that sense of social relational support. And of course, everything that we do is evidence-based, which means every single technique, even what we are trying to do with the MiDAS and this app, it's all driven by evidence-based research. So the research ultimately shows, this is just a snapshot, that music therapy-based interventions, including music listening, singing, instrument playing, are all widely accepted as beneficial for psychological well-being of people with dementia. In fact, one of the medical gold standards that are used as a reference is the Cochrane Review, and they have actually found that music therapy has positive benefits for individuals with dementia. You can look it up, it's called the Cochrane Review. And music is valued as an easily accessible, stimulating medium, which You can either deal with the individual with dementia on their own, or you can bring in the caregiver and you can conduct activities in a social context where there's more than one person involved. Care home residents with dementia families have highlighted music listening, singing, and dancing as particularly meaningful amongst all care home activities. So this just gives you some level of evidence to show you that music benefits people with dementia in many ways, including caregivers. So Dr. Oliver Sacks actually said, when they've done countless neuroscience studies, nothing stimulates the brain as much as music. And it's literally amazing when you look at the brain under the MRI, when someone is awake and they are subjected to music and they use the MRI to measure brain activity, they literally see what looks like fireworks going on all over the brain because the brain is so actively engaged with music. So what I find has been the most meaningful part of my work is to see how music is such a safe and supportive, but also a creative channel that enables people with dementia to express themselves, to be able to discover parts of themselves that may have long been hidden, and ultimately to encourage them to engage in the kind of day-to-day real-world interaction with those who are around them. And in that way, music provides a sense of security, consistency, normalcy, and preserves the dignity of people with dementia. So with that, I'd like to thank you. I know it's been very short, but I hope that this just gives you a brief glimpse and a snapshot of the benefits of music therapy for people with dementia. Thank you for listening.